as they are with the pandemic's impact on their livelihoods. A survey conducted by Infotrak in conjunction with the Kenyan National Commission on Human Rights further reveals that 54% of Kenyans will shy away from seeking treatment for COVID-19 disease for fear of stigmatization. The survey also reveals that 38% of Kenyans were evicted from their homes between March 2020 and March 2021 owing to the economic impact of the pandemic.
Employment, high cost of living and access to healthcare are the key issues of concern among Kenyans. According to a survey conducted by Infotrak in conjunction with the Kenya National Commission on Human Rights, KNCHR, the majority of Kenyans are of the opinion that the COVID-19 pandemic has extremely affected the activities of Kenyans.
Most of the vulnerable families went back up country from the urban population. Most were laid off work. Most had to look for alternatives on how to survive, and it changed the social development of their children.
The survey conducted between July 2020 and March 2021 further reveals Kenyans are concerned about the lack of adequate measures to protect COVID-19 victims from stigmatization and discrimination. In a survey conducted among 2,430 respondents, 39% of Kenyans decried inadequate equipment in health facilities, 33% reporting lack of enough personnel, while 39% cited lack of enough drugs at health facilities. However, most Kenyans opted for public health facilities to private facilities.
There has been minimal to no waivers on fees and charges to the vulnerable groups in our health facilities, both public and private, during this COVID-19 pandemic. And this is cross-cutting to all the ailments, not just the COVID-19, but to all the ailments that the vulnerable groups face.
More than half of the respondents confessed to having had their water supply either disconnected, spent more money on water and paid for water. 38% of Kenyans had been evicted from their homes between July 2020 and March 2021. KNCHR CEO Dr. Bernard Mogesa emphasizing the need for a multi-stakeholder involving both the private and the public sector to address the issue of unemployment, which has been occasioned by the protracted COVID-19 pandemic period.
Unemployment, high costs of living and access to health care are the key issues of concern among Kenyans. This was cited by 39% of the surveyed respondents. Other key issues affecting Kenyans include